Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Welcome to another episode of Creative Caregiving and Beyond. And today we have a special guest. We have Tawala Marchman, and she's the director of nurses. She's a registered nurse. Tawala, welcome.
Thank you guys for having me. How's your day going?
It's going great. How about you? I know you've been busy today.
Yes, ma'am.
Well, that's probably every day for you.
Yes, ma'am.
Yes. How did you get started as a nurse? What inspired you to become a nurse?
To be honest, I just think my overall calling is just to serve people. No matter what it is, it can be cooking. I want to serve you. It can be caring for you. I'm just a serving person at heart. So nursing came easy for me because I have a lot of compassion and I just like giving back to others, especially people that can't do for themselves.
Right. Yes. And so you have a big responsibility at Tremont, I know, overseeing many patients, many residents. About how many residents do you oversee?
Right now, our census are in the 80s, but we can get up to 130.
Oh, wow. That's amazing. That's amazing.
Yes,
And
ma'am.
can you explain, I know at a long-term care facility like a nursing home, there's a requirement to have a nurse, a registered nurse on staff. Is that correct?
Yes, ma'am. I don't know about other facilities, but I pride myself in having nursing, especially RN staff, as round-the-clock coverage.
Oh, wonderful. Let me ask you this. Now, I know that I work with Medicaid clients, clients who are applying for Medicaid rather, that enter facilities like Tremont. And I know one of the requirements or criteria that I don't necessarily get to work with the client on because it's out of our hands is called medical necessity. And they have to meet that criteria. Exactly what is medical necessity?
So medical necessity, in a nutshell, like anybody just that wants to come to a nursing facility doesn't mean they're going to be approved or qualified. You have to meet certain criteria to come on board for as some kind of cognitive deficit. A lot of times, just think if just because you're 80 years old and you live at home and you're able to do all your medicines, you're able to cook, clean, do everything yourself, you may or may not meet medical necessity. It has to be a service you cannot provide for yourself. You need someone of some certification or license to perform for you.
And that's determined once they get in the facility, or how's that determined?
Well, if they're in the community or if they're in a hospital settings, we could request a mini mental. Sometimes some may request a slums. We could request a medication administration to see if the clients know why they're taking a particular medicine, because a lot of times they can identify things to show that that patient do have some cognitive deficits.
Okay. Now, is it cognitive deficit alone? Is it a combination with physical impairment or physical situation?
Yes, it's a combination of both.
Okay.
Just think if a patient was blind on diabetes medication, not able to manage their medicine, they may not have any memory issues, but that patient will probably qualify for medical necessity.
Okay. Well, and how does the nursing staff at Tremont, how do you play a role on a daily basis? Paint a picture for us for those of us that may not have a loved one in a facility, but are thinking about it's just about time for them to go to a facility. How does your staff play a role in interacting with residents?
So from the start, from the door, we're very well.
Okay.
The biggest thing is I noticed that it is not easy putting your loved one in a facility. A
Okay.
lot of families, like that's like the last resort, because these are key players in your family that then raise everybody, and now they may need a little help or something. So a lot of times it's a big adjustments for families. So when they come into Tremont,
Uh-huh.
we make everybody feel like family. Not only the patients have my phone number, but the family have my phone number. And when like just coming here, my biggest thing was customer service.
Okay.
Customer service, treating everybody how you want to be treated, treating everybody like their family. It's not easy. We work with the families to actually to teach us how to care for their loved ones because they know them better than we do.
That's
They'll have
true.
to say, well, hey, my mom may need a little extra attention because she's a fall risk. And then
Right.
just by that key information, we can put interventions in place for the loved one. Or if my mom is not eating, we can get speech involved to see is there anything going on for a speech, or get dental involved, or
Okay.
just other entities to see how we can assist the patient and their family.
Well, I know that really is a relief for the family members too, to know that you
Yeah.
guys go to that extra mile and really, care about that customer service, and that's a huge thing. That's so big. Now, does your department, the director of nurses and the nursing staff, play a role in care plans with the family?
Yes, ma'am.
Okay, and
Um,
and I guess I'll back up and ask you, what is a care plan? So those of us who don't quite know
for
exactly
care
what does that
plans,
cover. Yes.
so care plan is an individualized care plan based on a particular patient needs.
Okay.
No patient is going to have the same care plan. Every
Okay.
patient needs are different. Every patient needs are different.
Hmm.
So not only do the director of nursing, but my assistants, and I actually have two, and my treatment nurse and our MDS coordinators, we
Okay.
all play a key part in making sure that we are individualizing all of our residents' care plans. What worked for Jennifer may not work for Twala, so
Right.
everybody's care plan is individualized.
Great. Great. And advice would you give a family member that has a resident in your facility? What advice would you give them as far as their care is concerned, and keeping track of what's going on?
Well, the good thing about my company is that we have like a portal. They can actually see day to day interactions that we're having,
Oh,
just open and good communication
yes.
with the families and with the patients about everything that's going on. That's just like my biggest recommendation is just staying involved. Sometimes that really helps the residents
Uh huh.
thrive better when they know that, the daughter is coming, my son is coming, just family involvement.
Okay. Okay. So the portal, is that online that they can access at any point in time to see what's going
Yes.
on with their health? That's awesome.
Yes, ma'am.
Yes, yes. So that's sort of like your health portal. If you go to the doctor, that same type of information is accessed for the facility.
Yes, ma'am. And also they can make payments on there, see notes and updates and stuff like that.
Wow, that's really great. That's great, great. Good to know. I didn't even know that existed at this point. So that's good to know. Um,
Yes,
if
ma'am.
someone's coming from home and they're entering a facility, do you do an assessment, or how does that medical necessity determine if they're a fit when they're coming from home? They're not in a hospital. They're not. I mean, how would you know? How
So
do you guys handle it, and how would a family member know it's about time for them to maybe go into a facility?
so most of the times the families are most of the time the patients, unless you like my mom, most patients they don't want to be in a facility. A facility is like the last resort. My mom makes jokes and say, I don't ever want to put a burden on you guys. Just put me in a facility. I'll be good. But
Hmm.
most patients don't think they would elect. to go to a facility.
Hmm.
And so when families see the patients declining, probably having a lot of falls, probably, you know, uh, organs not functioning, and they may be interested in putting them in a facility. One thing I would always encourage family to do is visit the facility.
Okay.
Visit the facility. You're about putting your loved one in and visit, as often as possible.
Great
So
idea.
stuff like
Yes.
medical necessity, we do have forms and stuff. If a patient is at home, we can get a physician to sign. Um, Home health could sign. Anyone could actually answer a lot of those questions
Okay.
for
Okay.
the patient to see if they meet medical necessity. And once they fill out those forms, we review it and determine if they actually meet medical necessity.
Okay.
But sometimes they may just uh, heal short term and get back stronger, and the goal may be to go back home.
Okay. Okay. And let me ask you this, Tawala. In your career as a nurse, a registered nurse,
Mhm.
and also working at Tremont, or either one, have you had an experience that's truly impacted your life as a nurse, or family interaction that you said, "Well, I'll never forget that time"?
I done had so many in nursing. I done seen God just amazing things. Um, Recently, when you guys go to our Facebook page, we
Yes.
did have a resident come into our facility, wasn't walking, wasn't able to do a lot of things for her. She was able to come in, get therapy, and now she's back in Minnesota, Missouri with her loved one.
Really?
Um, yes, ma'am. I've
Wow.
been seeing a lot of people come in broken, not just body wise, but mentally and
Yes.
physically as well. And just being a voice of reasoning or someone that they could talk to and
Hmm.
just building positive relationships. My nursing career, I'd have met some extraordinary people and seen some life changing things. There's just so many things I could think of when it comes to my nursing career.
Well, it sounds like you're doing making a huge impact, and I know you're a mom and a wife, and we kind of talked about that too. And
Yes,
how
ma'am.
many children do you have?
I have 6 children. I have 7 grandchildren. One of my daughters, she's 25, and she just have another baby. And I'm just grateful and thankful for life itself. So I never have a dull moment. But right now, it's just me and my husband at home living our best life. So
I know you are as empty nesters.
yes,
Well,
ma'am.
well, you've not only impacted your own family and your grandkids now. You don't even look old enough to be a grandmother. I can't
Yes,
even believe
ma'am.
that. And then,
Yes.
but you're affecting other families too. So you have a
Yes.
giving heart, and it's evident.
Yes, ma'am. A lot of people say they'll give the shirt off their back, but it's proven that sometimes I give too much. And I know that at the end of the day, my reward would be in heaven. If you guys don't
Amen.
mind me saying that, and
No,
that's
I don't
just the
mind you
way I,
saying it
I
all.
look at
Yeah.
life. That's my ultimate goal here on earth is to hear well done at the end of the day.
I totally agree. I mean, we work unto the Lord, and that's it.
Yes,
We work
ma'am.
unto the Lord, not to other people. And when we do that,
Yes, ma'am.
we're given the best of us. I totally agree with
Yes,
you.
ma'am.
Yes, yes. Well, Tuala, I thank you so much for coming on. I know this has been a very busy day for you, and
Yes, ma'am.
we'll have to
Ma'am,
have
I
you
apologize.
back in the studio at some point too. And
Yes,
thank you
ma'am.
so much. You've got so much knowledge and such a giving heart. And congratulations to you, and thank you for sharing your experience and Tremont with us as well.
Yes, ma'am. Thank you guys for allowing me to come on. And I enjoyed watching your shows, and I think you guys are amazing. So keep up the good work.
Thank you, thank you.
Yes, ma'am.
Well, thanks for joining us on another episode of Creative Caregiving and Beyond. And don't forget to like us and subscribe to our channel, and we'll see you next time.